The President, John Dramani Mahama, has announced that every metropolitan, municipal and district assembly will be required to build 2 community-based health planning services CHPS compounds every year as part of the government's drive to expand access to primary health care across Ghana. Speaking during an inspection of the Ohiamba CHPS compound and the presentation of free health care kits at Ebura Asebu Kwamankese in the Central Region, President Mahama said the initiative is aimed at ensuring that people in rural and underserved communities, especially those without health insurance, can access quality health care close to where they live. He explained that with Ghana's 261 district assemblies, the policy will result in the construction of thousands of new CHPS compounds over a 4-year period, significantly strengthening the country's primary health care infrastructure. President Mahama said the government will deploy newly trained nurses, midwives and physician assistants to staff the new facilities, creating employment opportunities while improving healthcare delivery in rural communities.
How do we help our people in the rural areas who are not under medical insurance? So the first we did was we said every district assembly, every year, must build 2 new CHPS compounds. So it means that 261 district assemblies in 4 years, that's 261 times 8. You can imagine the number of district CHPS compounds we would have built. And we're going to post our daughters and others who have finished nursing training school and physician training to man these CHPS compounds. So on the basis of that, we can now launch our free primary health care, which is what we did. And so this is one of the new CHPS compounds the Ebura Asebu Kwamankese district has built. And so the minister was kind enough to bring all the equipment to equip the CHPS compound. So you have your beds, you have your delivery bed, you have the consulting room, you have your high blood pressure monitor, they can check your sugar, they can test for everything. Indeed, when we entered the delivery room, the beautiful Queen Mother said, the way she sees the delivery bed, she's thinking that she should have a child again. And so this visit was just to see how the free primary health care is going.
President John Mahama stressed the importance of regular health screening as a key pillar of the government's free health primary health care program, urging every Ghanaian to undergo a medical checkup at least once a year to detect life-threatening conditions early. He noted that many people unknowingly live with conditions such as hypertension and diabetes until they become life-threatening. The President emphasized that routine screening can prevent avoidable deaths and disabilities.
An important part of the free primary health care is the health screening. Today we came in here and the first patient who is being attended to, she said she feels body weakness and that she feels dizzy. As soon as they put the high blood pressure monitor on her, her pressure was 183 over almost 100. And so somebody like that will be walking and then just fall down and either die or get a stroke. And then they will blame some old witch in the village that she has caused it. But these are things that we have to check. And so one of the duties of these, all the CHPS compounds with the free primary health care, is that they'll do screening. And everybody should be screened at least once a year. Go for medical tests and be screened once a year. They'll check your blood pressure, they'll check your sugar to make sure that you're not in danger of becoming diabetic. And they'll test everything so that they make sure that you're in good condition.